Good evening, our viewers. Welcome back to Health Up. This is a show all about health and wellness. So we know we are here to empower you and to enlighten you, to give you information about health so that you can boost your health. So keep on this dial, continue listening to us. Last time we talked about the perspectives of COVID-19. And we know that COVID has been associated with many underlying conditions, and one of them has been diabetes, where people have said that those who have diabetes tend to get very severe COVID-19 disease. So today we want to talk about diabetes. We want to see whether it is associated with COVID, and we also want to tell you how you can prevent yourself from getting it and how you can manage it. So my name is Dr. Sylvia Mwathi Bundi. I'm a pediatrician by profession, and on the show we have two of my colleagues. On my right we have Mr. Sami, and on my left we have Mr. Onesmus. They're going to introduce themselves even as we handle this conversation on diabetes. Welcome.
Thank you, Dr. Good evening, viewers. I'm Samuel Giteru Mwangi. I am a clinical officer trained in emergency and critical care medicine. You are welcome.
Yeah, thank you so much, Sami. So, Onesmus?
Thank you. Good evening, our viewers. We want to appreciate and we are happy for this moment that we have even to discuss on this topic about diabetes. My name is Onesmus Mogo. I'm also a clinician and also trained also in areas of public health, disease control. Currently doing private practice with the Oak Medical Center that is in Thika along Garissa Road, and we are happy to discuss this tonight. Karibuni sana.
Yeah, thank you. So maybe to start us off, Sami, you could tell us what is the definition of diabetes?
Thank you, Dr. Diabetes, when we're talking of diabetes, we are looking at a chronic condition, metabolic problem that involves sugars, in simple terms, sugars.
Okay.
This is how glucose, or sugars we take, food we take, which has calories converted into glucose, how it is metabolized in our system and then used up. We know that glucose is essential for our function of our body. Yeah. Actually, it's the main source of fuel of our cells, and also the brain. Yeah. And we're talking of persistently elevated blood sugar levels in the body. This is a condition, as I said earlier, is a chronic condition, and could have amongst along the pathway of glucose metabolism, could have been a problem in that path. We have the result of elevated high blood sugars, and that is how we come up with the chronicity of this condition called diabetes.
Okay. And I think just for our viewers to understand, because I may understand what chronicity means, maybe you could tell them what a chronic condition is. Is it a terminal illness? What does it mean?
Thank you. Chronic means that it's a long-term condition. It is a condition that one will live with. It is a condition that is not to be treated and one to recover fully from. Yeah. It is sometimes a condition that one will live with for the rest of their lives. Yeah, that is the chronic term.
So in other words, it's like there's no treatment for cure, but basically the patient is trying to manage the condition.
Absolutely.
Okay. Yeah. Maybe you could mention about the types of diabetes. People have heard of them.
Thank you.
The commoner ones.
Sure. We have several types of diabetes. The common ones, we have type 1 and type 2. Others, just to mention, we have gestational diabetes, and probably we could look at type 1 and 2. Okay. Type 1 is where we have a condition of elevated blood sugar levels persistently from a cause that is from the body itself. That is an autoimmune process. When the body cells, the immune system of the body, which is usually fashioned to fight against foreign agents like bacteria, viruses within the body, they now turn to the body itself and affect the cells that produce insulin. Insulin here is a hormone that helps the cells absorb the glucose that is circulating in the body and keep it at an optimum level. Okay. So when we have a problem at the pancreas, where the cells are, then we end up with the minimal production
Yeah.
of insulin, and subsequently high elevated blood sugar levels.
Yeah.
This is type 1 diabetes. It most likely occurs to young people, adolescents,
And children.
and children.
Yeah.
And for the type 2, it's a condition where the insulin is produced in the pancreas cells, that is the cells, the insulin cells. And when it's produced, the body is resisting towards that insulin, that hormone. Therefore, leading to a condition where we'll need too much insulin
Yeah.
Production in the body for it to function normally. And because normal physiological function of the body will not allow that, we end up with higher level of blood sugars, and that is now type 2 diabetes.
Okay, so you've mentioned that we have a lot of resistance
Yes.
to that insulin. I think, Mr. Onesmus, you could tell us what can cause this resistance of insulin, because when someone is born, they're okay, but at some point when they are older, then they develop this condition. What could be happening to the system?
Thank you very much. I think Daktari is explaining very well, these two types of diabetes. And looking at that in terms of the insulin resistance, basically there are some factors that will come in, so that now that's insulin that was supposed to access the cells. Because if we take it a little bit further, we would say that the function of this particular insulin is to allow the glucose that is actually in the circulation to get into the cells, so that the cell can access that particular glucose to use it in the body. So it basically means that insulin is not coming from the blood or from the circulation inside the cell. So at the surface, or where there's supposed to be receptors whereby the insulin is supposed to be acting on, there is resistance.
Yes.
Now the factors that could be coming here in, some of them are genetic factors.
Okay.
And it has also been shown that family predisposition, some genetic factors or genetic reasons have played a role in terms of bringing in this particular resistance.
Yes.
Others, of course, will be environmental factors and exposure even to heavy metals, and some of them have also been shown to have a problem in this. Other factors basically are going to be like increase in body mass, in which term we call it, or we refer to it as obesity.
Okay.
Whereby the relationship between somebody's height and their weight,
Yes.
the body mass index, when the BMIs are really high. So the cases of obesity also create cases or scenarios whereby there is insulin resistance, and therefore there's no access.
Yeah, very true, very true.
And
Yes.
of course there are other factors. Studies are still going on towards this, because there are some other details are not clearly well understood about also what are the other factors are playing. But as we move along, we'll also be able to break down some of the other issues. Yeah.
Okay. And what are other causes apart from now these predisposing factors? Are there any issues that could involve the pancreas, maybe in the destruction of the cells?
Yes, absolutely. There are other factors, or there are other causations, other than these few. Diseases of the pancreas, any disease that is going to be affecting the pancreatic function.
Yes.
As Daktari began, he brought two types of diabetes. Of course, there are others. We don't need to go to details with them.
Yes.
But diseases that are going to affect the pancreas, especially inflammatory processes,
Yes.
for a long period of time, what we call chronic pancreatitis, diseases that are going to cause, or that are going to cause change within the pancreatic cells, bring in cancerous processes,
Yes.
are also going to be factors that are going to affect the production. Because as we know, the pancreas, one of the major part of it is produces hormones. This is another function of it, producing the digestive enzymes,
Yes.
but the hormonal part is not going to be affected.
Yes.
So pancreatic diseases. The other thing or problems that will basically come in when we talk about the pancreas and insulin production is if we have destruction of the cells, what we call the pancreatic beta cells.
Yes.
This could be through autoimmune processes.
Yes.
And probably because that may sound a bit complicated, when we say autoimmune, we mean that the body is having an autoimmunity. It's defending, it's rather fighting its own cells,
Yes.
which is not supposed to be the case.
Yes.
So it is not able to recognize that this is self. So the self in terms of white blood cell is also fighting self.
destroying
So
itself.
autoimmune processes,
Yes.
are also part and parcel of the causation of these diseases. Needless to say, in this week of COVID-19,
Yeah.
viruses, if I may probably just, expose on that, is that COVID-19 disease or COVID-19 virus, SARS-CoV-2, which is basically the cause for COVID-19,
Yes.
has also been shown to be playing a role,
Very true.
because some of the receptors have also been studied. A lot of studies, a lot of research, a lot of work is going on, but already there's some receptors that really are on some of the body parts, or they are going to be very sensitive on some of the body parts or body organs, like the adipose tissue, the fat tissue, kidneys, and the pancreas.
Yes.
So these receptors, we call them in another language, the ACE receptors. They're also basically also in the lungs.
Yes.
They have also been shown that the COVID-19, because of having that high propensity to these particular receptors, and they are on these particular organs, that they are actually contributing and playing a role in terms of causation of this disease, diabetes, because it's in the pancreas.
Yes.
So again,
that means if the COVID is to infect someone, then it will end up destroying part of the pancreas.
Exactly.
And therefore reducing the amount of insulin.
Reducing the amount of insulin
production
that they have, and finally we're going to end up with diabetes. And there's also a lot of association that has also been shown. Even people with, the COVID-19 pneumonia having more, predisposition to diabetes because of, again, insulin issue in terms of production, as opposed to those who have none, COVID pneumonias. And therefore, again, COVID-19 is slowly being implicated as being one of those things we call diabetogenic, or meaning that it plays a role, is a direct causal relationship, between COVID-19 and diabetes. And no wonder we are seeing there's a lot of association in the same.
Are there any other infections that could be causing diabetes, maybe apart from COVID? Are there any other viruses that have been associated with hyperglycemia? Maybe Sami, if you've heard of any?
Sure, Doc. There have been quite a number of viruses identified to be associated with hyperglycemia.
Yeah.
And this includes the other groups of coronaviruses, some of them, and measles virus, mumps. All these have been recorded, have been really seen, having an association with the hyperglycemic issues.
So basically, they're causing the blood sugar to be elevated, but not really known to cause the diabetes.
Absolutely, yes.
Okay, but what apart from maybe saying that COVID has a causal relationship with diabetes, what has been the prevalence of patients who have diabetes and COVID?
Yeah, that is a very good question, Dr. because it's really been observed in our health facilities.
Yeah.
For all those patients being admitted with COVID pneumonia.
Yes.
Like quite a big number have been recorded, but the recorded number ranging up to 20% of patients with hyperglycemia. That's a significant number. And also this was recorded in China sometimes back.
If a patient has diabetes, they tend to have moderate to severe COVID as opposed to the very mild conditions.
Exactly.
Yeah.
And it's a bi-relationship between COVID-19 infection or disease and the hyperglycemia.
Yes.
One is COVID may trigger hyperglycemia and probably end up to diabetes. And now diabetic patient having COVID infection, it's really becoming a severe illness. And
that's not uncommon, because we know that whenever a diabetic patient has an infection, then it becomes very difficult to control their sugars. Yeah.
It's a serious problem that we really need to keep at the back of our minds and think through it, especially for the medics who are dealing with these patients.
Yes. When you have diabetes, it doesn't really increase your risk of getting COVID. It just means that once you get the COVID, then you're at a high risk of getting a more severe disease, which I think is very good. It doesn't mean that if you're diabetic, then you're at a risk of getting severe disease.
You're very correct.
Yes. So let's mention about some of the myths that are out there. People tend to believe that sugar is associated with diabetes. Is that really true?
Now, actually, Dr. These are main debate in the community.
Yes.
Like someone has been diagnosed with diabetes.
Yes.
They now say no more sugars.
Yes.
Like I will just survive on sugarless stuff.
Yes. Dufia.
and all these things.
Yes.
And that's what's happening out there. And the reality of the matter is that we need sugars for everybody to function normally. That, as I said earlier, is a source of fuel for all our bodies and cells. But for diabetic patients, it is important to know that we limit the sugar intake that we have.
True.
And which are these sugars are we talking about? In our meals, we need to know what we are taking in terms of content of the food stuff we have.
Yes.
Nutritionists are usually very good to advise our patients in the hospitals on this. And I know all people who are diagnosed with diabetes and they go for outpatient clinic, they really advise on this.
Yes.
That in a plate of meal, a quarter should be carbohydrates or starch, a quarter should be protein, and the other half should be vegetables.
Yeah.
This is because starch at the end of the day will be converted to sugars.
Yes.
To glucose, and then if it's excess in the body, it leads to conversion of this glucose into glycogen, then stored in form of fat, which now predisposes someone to most resistance of insulin.
Exactly.
And just to cut it across, what we have in terms of statistics that we have is the middle class population. That is, these are people who can afford to go to KFC and buy chips in buckets and
buckets of chicken.
Yes. And they can buy the 2-liter soda and take it, and they're okay. Then at the end of the day, they drive home comfortably.
Exactly.
And they are also moving from more manual work to probably easier work. They are less active in terms of physical activity. So this population is really exposed to has been seen being more exposed to the risk of diabetes because of that habit of consumption of extra sugars. That is, free sugars in food. Once they are taken much in the body, they become now are converted to glucose, subsequently stored in the body as a form of fat, predisposing someone to diabetes. Yes.
Okay. So what's your take on on this issue of nutrition?
For metabolic functions, or for what we call the basal metabolic functions or basal metabolic rates, for all that to be optimal, sugar is required, and basically the small form of sugar, which is glucose. So the intake of sugar, even if we're talking of diabetes and there's the issue of elevated sugar levels or blood sugar levels, the truth is we will require glucose and will not move from that fact. So, and we will not say that it is impossible for us to be taking the sugars in whichever food, whether it's carbohydrates, whether it's proteins, whether it's fats, all of them are going to require sugar. But now, what you're going to say is, or what is important is, can we be able to take this in moderation?
Exactly.
And
that's the word, moderation.
Moderation, and be able to tailor what we exactly have to fit the need of the individual or the person. So that we're going to have a plate, and Dr. is explaining very well, we're going to have a plate that has all these types of food, and we're not going to demand that you must eat fish for your sugar to be controlled, and where you are you can't access fish, just to mention, or you must eat this type
especially in central.
I mean, in central Kenya, and you're saying you must have sea fish. Some of these are going to be unachievable. But what is it that is in central Kenya, in the lake basin, or in the seashore and all that coast region? What is it that is there that we can be able to tailor to the need of the patient? So that is what we need to look at, and that is what we need to think about. And we need to know that, as Dr. is saying, some of these extra added sugars and free sugars, they really contribute a role in terms of bringing in other issues like obesity, like we just mentioned. And when these come into place, we again end up with insulin resistance, like we said, and we're going to end up with full-blown diabetes. So nutrition is a very big aspect in terms of this. Yes.
And I think I'd just like to tell Sami, maybe if he could explain to us the difference between the natural sugars and the free sugars.
Sure.
Yeah, as he had mentioned about them.
Yeah. The natural sugars are the sugars that we have in the foodstuff.
Yeah.
These are naturally in the content of what we are taking. We are not added, but the added sugars and the free sugars are the ones added from the industrial, production of foodstuff, like candy, sodas, and so on and so forth. And this is what is bad sugar in terms of glycemic control and what we're talking about.
Yes.
So when we say when we're talking about the added sugars, these are the sugars that have been added to foodstuff.
Yes.
Most likely are more industrially done.
In the food processing companies,
yes,
and therefore these free sugars, what I just want to, the free sugars, they're really bad because they're not connected to any fiber.
Exactly.
Because where would we find the natural sugars? We'd find them mostly in the vegetables. We'd find them mostly in the raw fruits. And when we eat those foods, they have fiber, so it's the absorption of sugar will actually be slower. Yeah, but then when you take these free sugars, it just makes your sugar levels go high. Yeah, so that's really a problem. And I think it's good that we are bringing it up. So maybe you could tell us, any of you, how common is diabetes, like in our setup or even globally, from studies that have been done? Because we know that you said there's a rise in the middle class, there's a rise in people who have money, people who are living sedentary lives.
Absolutely.
Yeah, so how common is it now, compared especially to how it was a long time ago?
Yeah, Dr. That is a really good information for everybody to know. Because we're saying that the burden of diabetes has been progressively going higher. And I think as we have been told on and off about the change of disease processes, it's amongst them that we're talking about, that amongst them that diabetes is included there. Because it's one of the non-communicable diseases which is leading to actually medical emergencies.
True.
Now, when we talk of numbers in diabetes, is by WHO actually, that is World Health Organization, it reported in 2019 that in 1980s, we had a certain percentage of patients globally having diabetes. But by 2014, it had doubled.
That's so sad.
That's about more than 300 million people in numbers. But it showed that there was a significant increase on the diabetes. But locally, there are studies that have been done, and probably cross-sectional observational studies done in Kenya, have shown that many people don't know their status of glycemic control. They have never taken sugar tests. They have never gone for evaluation of their medical status.
Probably to add on that, from that data is talking about, like 2019, an estimate of 300-400 million globally of people who, who have diabetes, those ones that are actually reported. And the postulation is by the next 20 years, by the time we get into 2045, that number will actually have doubled. And, to around 700-800 million. And the impact of that is very great. Now, let me just say this. Diabetes is actually one of the leading causes of adult onset blindness. So as a complication. Number two is also one of the leading causes of end-stage kidney disease. And, when talk about, amputations, or whereby people get part of their limbs, just cut, chopped off because of the disease, is on the lead, in terms of causing lower extremity amputation. Now, what that tells you is, if we have these numbers growing like that, and we are having these as the complications, we're having adults beginning to become blind, from, as the adults, that
Yes.
tells you it increases the cost of living to a very big extent. Remember, these adults are the ones who are the breadwinners. They are the providers in the family.
Yeah.
They have wife and children, assuming as a man, or
Yes.
assuming as a woman, then there is husband and children.
Yes.
And some people are dependent on them.
Yeah.
Now they are blind. So there's a cost, in terms of treatment of the disease.
Yes.
They need medical attention because they are blind. Their diabetes needs to be controlled and all that.
Yeah.
But there is also another cost that could also not be well documented, because now what about their dependents? What are they going to live on?
Yes.
What are they going to do? So
Yes.
that means another person is going to take responsibility,
Yeah.
of these families and of these individuals. So really the cost of living becomes very high.
Yeah.
The cost of managing these patients goes high.
Yes.
And the people who are actually dependent also goes high. So you can see the burden is not only on the patients,
Yes.
the burden is also globally to
whole
the community,
family.
the whole family.
Yeah.
And you would find that one person is the one who's, dependent on many other, many other people are dependent on this one particular person.
Okay.
So the global picture, the global burden is really great. Now, we are only talking about those numbers that are actually documented. The question is, what about the undocumented numbers? That's one question, because you still have some sudden deaths because of complications, some heart attacks that are not documented, pneumonia, and many other things resulting from this particular disease. That's one issue. What about all that? Number two, what about those that are actually diagnosed with diabetes mellitus and they are not on regular follow-up?
Okay. So to our viewers, we're going to go on a break. And as you've heard, the burden of disease of diabetes affects not only the family members, but it also affects the whole community. So when we come back, we're going to look at how the diagnosis is made, how to manage it, and even how to prevent it. So thank you. Keep watching.